I've been trying to call. I've been on my own for long enough. Maybe you can show me how to love. Maybe I'm going through withdrawals. You don't even have to do too much. You can turn me on with
it's surgery day.
I look around and Sin City's cold and empty. No one to watch me. I can see clearly when you're gone.
Finally time to get my arm and back lift. Oh my god. We're probably gonna be leaving here in about 20 minutes. And of course I woke up and my eyes like swollen. It's been happening a lot lately. I don't know what's going on, but it'll come down on its own. I don't care. But before we get into today's vlog, if you've never seen my face before, hey girl, hey, my name is Janee and I make a lot of content focused on fitness, wellness, and self-development and helping you and I live our best healthy and active lives. So if that sounds like something you're into, go ahead and hit that subscribe button. Follow me on TikTok, Facebook, and Instagram. And let's just jump right into today's vlog. If you're new here, let me catch you up real quick. I lost 128 pounds utilizing weight loss surgery, GLP-1s, naturally changing my relationship with food, working out. My life looks totally different in these last 2 years, and I did an entire video talking about this, so I will link it right here. And now I'm getting a phase 1 loose skin removal of an arm and back lift today. And all of that information is up. Everything, you'll find it on my channel. So this morning, I'm supposed to be fasted from midnight. Nothing to eat, nothing to drink, not even water. It's like the moment they tell you not to drink, you get so thirsty. I'm so thirsty. So I probably had my last something like before 9 p.m. yesterday. I used the antibacterial soap to take my final shower, brush my teeth, wash my face, do all the things on my own. I'm in my little surgery outfit, which this came from my Amazon haul, so check out that video. But it's just a button-up pajama shirt with pockets right here for my drains, my pajama shorts, and compression socks and Birkenstocks. And I am bringing a sweater. And they also told me to make sure I had all of my medication. And, you know, I'm a content creator. I'm bringing all the content stuff, but that's it. I'm supposed to report to the hospital by 6:30. It's only 10 minutes from here. And it's supposed to start around 7:30-ish. And 5-hour procedure, outpatient, so I don't spend the night in the hospital. And I come right back here later on this afternoon. I will try to get as much footage as I can, but, you know, I'll be out. So when you're
blinded by the lights, no, I can't sleep until I feel your touch. I said, drowning in the night. Oh, when I'm like this, you're the one.
This is the real deal. So I'm going to be, I marked you yesterday, but this is really the marking, so I'm going to be taking a little bit more time thinking through it. I'm imagining the new awesome arms. Okay, is that one? One of the interesting fun facts that come with an extended brachioplasty that goes through the axillary armpit is I'm going to be removing some of your axillary skin or your armpit skin. Sometimes most of it. So you may not sweat in your armpits after this.
yeah,
or definitely a lot less, and maybe not have to shave as much either.
so how does that affect the lymph nodes, I guess that's there?
So the lymph nodes are deeper.
Okay.
Yeah, we're just doing skin, and that's one of the reasons that we're doing that kind of like liposuction technique, where what I'm doing is I'm separating the skin from the underlying important structures. So we're not going to be impacting the lymph nodes at all. That's the goal, at least.
Yeah.
That's why we do what we do. So again, I want to pull as much as I can without lateralizing your breast. That's the idea. Both arms out. Not for long.
Right. I up
All right.
muscle
Well,
filler.
you could bring your arm down. Now I'm gonna go on the back side
Okay.
and kind of duck under you.
I can turn around if you want,
No.
because I can flare out whatever I need to.
Let me just duck under you first. It makes it easier for me because I'm going to be manipulating back
Gotcha.
and forth,
So
back and
just
forth.
step a little bit.
Yeah. You know what? Guys, yeah, just watch how I'm doing it. Like, we're rarely, so he's doing cases, I'm doing cases. Usually we show up when the other person's done marking. So we talk about how we marked and what we marked, and then we rarely see each other mark. So found my point. I pulled her axilla back. She has some fullness here, so we do want to get it under some tension.
Yeah.
Okay? To drop it on the mid-axillary line, you're going to hear a lot of weird.
That's
Then marked it under tension right into the groove. Happy with that. Did it on both sides.
Yeah.
Now what I'm doing is I went back and I'm bringing I have that mark in my brain and I'm bringing the skin up to it.
Yeah.
And that's what I'm using to just kind of craft it right now.
Yeah.
We do things very, 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 very similar, if not the same, but it's like we never. It's weird how it works. Okay, so I'm happy with that. You can come down. I'm gonna step that way. I'm gonna go to this side. So she has. Yeah. So she has a little bit more distal laxity. So if you put both arms out, this one at the elbow it comes down. This one goes just a tiny bit further, a half centimeter.
Yeah.
I don't think that we'll need to go into the forearm. She has a little bit of laxity, but not a tremendous amount that I think will necessitate it. But so I think we'll be able to stop here.
Yeah.
But it's just slight asymmetry. So having differences on the arms is very, very common. No one's perfectly symmetric.
Right.
So,
Like you said, I don't want twigs on the top half.
yeah, we talked about that. You don't want just like
Yeah,
popsicle
yeah.
stick arms. And we were talking about part of our strategy is to try to not only bring things together, but try to bring this tissue in towards your body to try to get some of that weight off your elbow.
Yeah, I don't think Dr.
It
Bennett
hangs
saw it.
down.
but
Yeah,
you see,
yeah.
Yeah, we were
exactly.
talking about that yesterday.
So as we close it, we're going to remove
Yeah.
all the redundancy, but try to bring it up.
Yeah.
And I did talk to her about as we bring it up, you see how she gets like a little bit of a fold, like
Yeah.
right in here?
Yeah.
She may still have a little bit of a fold like that,
Right.
but we're going to do everything we
I
can to tighten it
do
up.
think she may potentially also have more skin wrinkling proximally here, right?
Yeah, well, we're going to be trying to bunch it up, but
Yeah.
I think that because our incision's so long, because we're doing the back lift, we have a
Yeah.
lot of freedom to
Yeah.
make up for some of the tension that we're going to be creating.
And it's more hidden there because it's inside your armpit, whereas here it's exposed, right, if we wear a t-shirt.
Right. You good?
Yeah.
I'm going to find mid-axillary pull down. Okay, this side. Just so we've got it. Okay, so now we're going to have you turn around.
Okay.
That's fine there. Perfect. Arms out. Arms back down. Okay, that's good. Raw line. Arms back out. Sorry. Give ourselves a little more tissue to work with there. So that's our point. With the tension, it butterflies up.
Yeah.
So that when we get it under tension, it'll flatten out. That's our goal. She has a little bit more laxity superiorly than typical. Usually it's pretty anchored, but I am able to get a little bit of a pull on it. Sorry.
Okay.
Arms down. Okay. Arms back out. Isn't that wild?
Yeah.
How
Yeah.
she just flattens right out. And then she's thinking about tummy 360 lower,
Yeah.
and that's going to take care of any of this lower.
It's amazing how tiny you are.
I know, it's great. Yeah, take a break. All right.
Yeah.
So, guys, if you see this side, it's going to connect really nice. So, inframemory fold, that's our resection line. That'll come up. So it'll be nice and flat. And then this will all come there.
Yeah.
Hi guys. Oh my god, it's the next day. It's Saturday. I wanted to pick y'all up yesterday, but obviously, for obvious reasons, that did not happen. So let's talk about Friday. So let's run through the whole day. I was just trying to protect everyone's privacy, which is why I wasn't really recording too much pre-surgery. But once I got there, I had some forms to fill out, did that. Nurse called me to the back, had my mom wait out in the lobby for a bit while she set me up. I found out I was the only case for the day, so they did allow my mom to come back both pre-surgery and post-surgery until I woke up. But I had to, during urine tests, change into my surgery garments, went back to the bed, got my IV, I got it in the hand. She gave me my first dose of antibiotics before surgery, as well as some lactated ringers. It's like, I forget what it is, but think of IV solution. And then I got my shot of blood thinners. My surgeon came, anesthesia did their thing, like the whole just doing the checks, verifying medical history, just talking me through it, all that stuff. By then my mom was back there. And then my surgeon came, he did the actual markups. I got a video of that. I'll probably insert it in here. But he did the actual markups. We took some pictures. My other surgeon, so Dr. Russo is my main surgeon, and Dr. Rona was just a surgeon assist, but he's a surgeon as well. That's what they do with their procedures for both bariatric surgery and cosmetic surgery, because they work together in the same, facility, whatever you want to call it, business. So I talked with him a bit, used the bathroom one more time, and then it was go time by 8:30 is when we got started. And so they rolled me, I walked to the room because I was using the bathroom, got on the bed, he strapped the oxygen to me, and that was it. Like, I don't even remember them sliding me over to the actual surgical table. That's why, because my doctor said that we would start with me prone. Prone is face down. Yes. So they were doing my back first. So they must have had to, knock me out before then. So he told me that it would take 4 or 5 hours. So my mom, I know she chilled around for a bit because she had some homework to do, then went back to the room and then came back. But then when I talked to my mom after, she said it actually took a little bit longer because they called her, because when he did my markups, but when I was laid down, they saw more skin that they could take, especially from my sides. And so, he wanted to give me the best results, take as much as he could. So that's what he ended up doing. So it took a little bit longer. And especially because, they didn't have any other cases. There was no need to rush or anything like that. So they took their time. So I appreciate that. And I don't know how long. He said they would monitor me for like 30 minutes to an hour. I really don't know what that timing was. I feel like it was like 3 something. I feel like we were out there by 3 something. I could be mistaken. I don't know. But we came back to the room. And I pretty much got in the bed and been in this position right here since. I had on my pajamas. I feel like I was back and forth when it comes to sleepy, just very groggy after the anesthesia. Once we got back, I immediately drank some bone broth. I was so nauseous, you guys. I was so nauseous. So I drank some bone broth to settle my stomach. I don't even think I took Zofran. I might have taken Zofran. I don't know. Um, that's a nausea medicine, but I needed to get something on my stomach because I hadn't eaten all day and I wanted to take the pain medicine. So I at least drunk the bone broth. Then I took my gabapentin and then I took my Oxy is what I have. And then I might have been like back and forth to sleep. And then maybe a couple hours later, we bought some bean soup. I showed y'all that in the pre-op vlog, I believe. So I'll link it in the cards above if you haven't seen that vlog yet. But it was just some bean soup. It was so good. But again, like my stomach was just not settled. So I ended up taking like 3 bites and I was just done. Um, and then I drunk my Juven. I started to take my Juven, my Arnica, um, my regular pain medicine. And by 9, before 9, like 8:30ish, I was passed out. I slept all the way until 1. I was knocked out. That's when I got up to use the bathroom. Oh, I didn't even tell y'all this. So when I got up to use the bathroom after I had woke up from anesthesia, I started my cycle. And I knew it. I felt it coming all week. And I was praying I felt it coming since last week because I get my PMS symptoms a week before it actually comes. And I was like, Lord, please let it drop, let it drop, let it drop, let it drop. He waited until probably was on the surgical table, probably was right there. I don't know. But it definitely dropped. So that's great. Knowing that I had brought the menstrual diapers. Because obviously I'm not going to use no tampon, no cup, not even a pad. I just wanted something that I was going to be protected with. So the diaper it is. Which it feels a little different. It's not as heavy, probably because of the trauma of the surgery. But yeah, so I'm dealing with that. That's great. Anyway, I had got up at 1 to use the bathroom and I had woke up with a burst of energy, like a burst of energy. So used the bathroom, took some more pain meds, gabapentin, all that stuff, drunk some more Juven, took some more Arnica, did Benefiber, took some of my vitamins, and then I stayed up for like 2 hours scrolling, posting, whatever, because I just was wired. Forced myself to go back to sleep about 3, woke up again at 5, and I have been up ever since since 5, and it is now 8:24. I'm starting to feel tired now though, so I may take a nap here shortly. But you guys, I need to tell you this part. So I think I got up at like, I feel like it was like 7-ish to use the bathroom, to get changed as far as, my diaper is concerned. And I had like a pulling thing. I think it's just the sutures on this right side over here. Oh my God. And my drain isn't draining. Like, I don't know if this is a good or a bad thing, but like yesterday there was like 2 drops of liquid in it. And even now it's 5 maybe of drainage that's in there. So I have a post-op appointment call with my doctor today, so I'm gonna tell him like all of the things. But yeah, after I used the bathroom, got changed and everything, we had stood in front of this bathroom over here, the mirror, and took off my pajama shirt because I wanted to make sure that I'm like not seeping through anywhere, but all is good for my ACE wraps and all that stuff. We looked at my drain. There's a little blood clot in it, but still nothing like really draining. And then I started feeling stars. And I told my mom, I said, I gotta sit down. I gotta sit down. So we came and we sat down. We tried to get my robe on, but my robe is for my normal size, so it doesn't fit. So as she was sliding it on me, I started seeing black. I started feeling hot, and I was like, oh, no, I gotta sit right now. And so she's like, you're moving too fast, Nay, you're moving too fast. And so I sat down and I just put my head on her and just until everything settled. Thank God I didn't pass out or anything. Oh, that would have been terrible. But she's like, you're moving like the old Nay, like the pre-op Nay. You need to like remember to slow down. I'm like, yeah, I do need to slow down. So that was that. Not wearing anything right now. Like, these are the Ace wraps that they have me in for both my back and my arms. I talked to my doctor about it, and he's like, it's just easier this way. And when I did my research, most women are just like this, like in the Ace wraps for their arms and stuff. Um, because putting on something, it's a lot. You just don't really want to be doing too much, especially when you have your back done. So I will be like this until he takes out my drain, and that's on Thursday. He said if I'm not draining, if everything's fine, then he'll take it out sooner. But we're scheduled for Thursday, and that I'll bring my compression, my faja then, and that's when I'll get into everything. So he's like, yes, with it's a little bit of inconsistencies when it comes to the Ace wraps, but everything will be fine. As far as swelling and molding my arms, is what we're referring to right now with the Ace wraps. But he's like, it'll be fine once you're in regular compression and all the things. So I was like, okay. So there's that. What else? But yeah, I got back into the bed, let things settle, drunk some regular water, took all my morning vitamins and pain meds and all that stuff. And then I drank a yogurt, the Chobani yogurt, to coat my stomach. That went down really well. I was a little bit nervous because after that whole almost blackout incident, I felt nauseous again. I was like, crap, I'm not gonna be able to eat. But now I'm eating. I'm just having some berries and two boiled eggs, and I'm drinking my Juven that's over here because I have to drink it 3 times a day for the first week, I believe. Yeah, that's it. I'm honestly probably going to put y'all down here shortly and take a nap. I did get my pictures from my surgeon. Oh my God. Oh my God. Make sure y'all follow me on Instagram because that is where it's going to be posted. I may insert some of the pictures here, but like the graphic pictures, because I don't want the graphic pictures to be on here and then the video gets taken down. So the graphic pictures will be on Instagram because they can just censor that. But oh my God, I already look so snatched, you guys. Like already, even through the swelling. Especially like with my back. It's kind of hard to tell with the arms, but like even with my back, I look so snatched. I look so good. As far as pain is concerned, yesterday I would say that I was like at an even 4. Like I had all the anesthesia and all that stuff in me too, so I was at an even 4. He did tell me that day 2 was going to be the worst of it because all of the anesthesia is out. Like everything that they gave me is out of my system by now. And he was right. I'm feeling every bit of it. This morning when I got up, like it wasn't too terrible. Like I would say I was at a 5. Like I was in pain, but I was at a 5. With my arms, it doesn't hurt. It just throbs when I'm up and I'm walking and my arms are down because it's not elevated. So I feel like that's where the pain comes from, and it's like throbbing, pulsating is how I describe it. But my back was fine. But then this morning, when I went to go get up on the right side, on this, like, I don't know if it's the suture or what, but it hurt so badly. Like, I kept having to be like, wait, I can't get up, I can't get up. And then that last time, we just kind of, like, I kind of just threw myself up with my mom's help. Um, it's just my back is just what's really in pain. My arms, they're still throbbing, but not as badly as it was before. Even when I was up walking around, it wasn't as badly. And still no pain. Like there's obvious pain there, like right, like but I would say at a 2. When I'm saying pain, I'm thinking like of my back. Like that is like overwhelming me. And my vision is a little off too. Like I wear glasses, yes, but normally I can see without my glasses, especially during the daytime. Like I can see. But I don't know. Like ever since I got out of anesthesia, things just feel a little bit more blurry. Like even yesterday I had to like ask my mom to put my glasses on my face and it was still light out when we got back in the room and I was in the bed. I was like, I don't know, I just can't see clearly. Like even holding y'all right now, like I'm looking at myself, it's blurry. So hopefully that clears up soon. Another thing I'm gonna talk to my doctor about. But I'm gonna finish breakfast, put y'all down. I don't know what time my call is, but I'm gonna try to like nap a little bit. My mom, she went to go get her some breakfast. I really didn't want their food. I'm just gonna eat with what we bought, and she'll probably bring me a banana or something, but for now I'm good. But I will see y'all later. Blueberry Kodiak waffles with some peanut butter, and then I have my electrolytes in here. Update for you guys. I talked to my surgeon this morning. We just went over everything from yesterday and then how I've been doing. He asked me my pain level, which my back is like at a 6 now. Arms really not even any pain, and the throbbing pretty much went away. With my output, like I'm only at like 5, it's really low. He said he's not concerned about it because even yesterday I was pretty dry, like as far as the surgical feel, like there wasn't a bunch of blood. I was pretty dry, so he's not surprised that my drain isn't putting out anything, or that like even my bandages is not like saturated or anything like that. But yeah, we talked through the procedure. He did say that it ran longer than expected, like 6.5, 7 hours, I believe, just because like I'm pretty sure I mentioned earlier, once I laid down on the bed, he was able to see some more lateral chest wall. He said my back was straight forward, like, and he even was able to take a little bit more off. So when I put in the pictures, you'll see that it's a big back slab and then a little small slab. That's because he was able to take off more. But when they flipped me around to do my arms, that was where the difficulty was, just because they not only had to cut off the loose skin, they had to lift my arms because my elbow, like my skin like draped over my elbow a bit. And that wasn't going to be perfect. Like the arm lift wasn't going to be perfect because of the drape that I had over my arm, because they had to cut the skin and angle it. But when they angled it, there was like a little bit of twisting, bunching, as he described it. And so, you know, we want to make it as aesthetically pleasing as possible while trying to take off as much skin while also pulling the lift towards my body. So that was where the difficulty lied, along with the extra skin that was on my chest. So like everywhere they pulled it, like there was a bit of bunching. So you want to, you know, just again, make it as aesthetically pleasing as possible. And so with that, they cut into my, my breast a little bit. Like I got a small, mini, tiny breast lift. Just because that's where you can hide the bunching, is under the breast. So, it pretty much worked out. There's a lot of swelling there, so I won't really see the after for a while. Probably see it on Thursday, maybe sooner. I don't know. But yeah, I'm gonna be like this. He said everything for the most part like went well. Anesthesia went well. Like everything was good. But yeah, he did say that him and Dr. Rona, once they cut into my arms, they was like, that's her tricep, that's her bicep. Like I have a lot of muscle definition. That was hidden away under my loose skin. It was like, no, like you have done a phenomenal job with your fitness, because like your muscles are bulky. They're big. Like we saw it all. He even sent me videos, and the videos of them cutting me open. I'm like, oh my God. Like I could see my muscle, my damn stuff. I'm like, oh my freaking God. Oh my God. So like, even with me getting up and down, we got up again to use the bathroom. I had my first poop. Wasn't straining at all. Shout out to that stool softener. Me taking it beforehand and the Benefiber really had me going. So I'm happy about that. But like even my mom is like, you can see your contour already. Like you can see your shape already. Oh, and then him and my mom were both saying like, because I was asking him about, you know, breast lift and my tummy tuck later on. He's most likely going to be doing that next year sometime. And he was like, because he knows I want a 360, but he was like, I really don't. I really want to see how your back heals, because there was a little loose skin on my lower back that my back won't take care of, but all of the other rolls, like this back lift took care of. And so he's like, I really don't think you're going to need a 360. I really think you can get away with just a tummy tuck, maybe even an extended tummy tuck, because I do have the love handles that spread to the sides. That's why I'm like, I think I'm going to need a 360. But he's like, either way, like, you know, they'll give me what I want either way. But like, he's like, I really don't think you're going to need like that full 360. So we'll just see how everything is healing and stuff. So kudos to me. Shout out to me. But yeah, I'm just eating something. I did not end up taking a nap. I have like this burst of energy. So I have been posting reels like all day. If you're following me on Instagram and TikTok, like I've just been posting all day because I just have energy. I'm taking advantage of the energy that I have and giving updates to the guys over there and to you all, because these are going, my reels end up going on YouTube Shorts. Because I haven't tried to like use my computer yet to download. I have a couple of videos that I've been wanting to post, but I'm gonna get to posting. I appreciate y'all. I know y'all are sending me well wishes and I see all of the comments and stuff. I appreciate y'all so much for checking on me and being just as happy for me as I am. And yeah, I'm gonna put y'all down for now though.
Heaven sent you to me. I'm just hoping I don't beat history. Boy, I'm trying to reach my on Sunday, but nigga let love on Monday. Don't need no one else, babe, 'cause I'll be switching in positions for you.
Hey guys, it's been a few hours now. I did take a small nap a little bit earlier. I've been eating a lot more frequent small snacks, but I did just have dinner, and it was so good. I actually ate that entire bowl. I didn't think I was, but I ate that entire thing. I actually could eat a little bit more too, but I'm just gonna chill. I don't want to, like, when I stand up to walk, I get nauseous, so I don't want to put too much on my stomach. But it's good to eat. It's good to hydrate so that I can heal properly. So I'm trying to make sure that I put, like, good things in my belly, and everything is all good. I'm just so tired, and I could go right back to sleep, which is what I'm about to do. So I think I'm going to end this vlog here and pick y'all up again tomorrow for the next vlog. I told y'all I was going to share all of the deets, all of the ins and outs, good and bad, highs and lows. Nothing too exciting today. The funny thing is, even though I got my cycle, it's not like the same as normal, which is a good thing, I guess. Just because, I just don't want to deal with all that stuff. It's too much as is. I am being a little bit more mobile, like I said. I just get lightheaded when I am, and I have to sit back down. I'm still on my pain meds and my muscle relaxer. Like it's just day 2. He said day 2 is going to be rough, and it's exactly that. But I am getting more fluids down. I am getting more food down, so that's good. Anything I left out? I don't think there's anything I left out. Because I have my cycle, I normally have like the period poo. So that has been helping to my advantage, even though, dealing with that is messy. But it's been helping me go. So I have not been constipated. I'm probably going to do a third poo because I can feel I can go right now. But yeah, yes. I am good. Thank you guys so much for reaching out. I see all the comments and stuff. I think I said this before, but I appreciate y'all so much. And I will see y'all in the next recovery vlog. If you enjoyed this video, make sure you give it a big thumbs up, subscribe if you haven't already, and hit that bell icon. That way you're notified every single time I post a new video. Make sure you're following me on TikTok, Facebook, and Instagram, especially Instagram. That's where a lot of these updates are happening. And I am posting short form content faster over there, so y'all can see the update with me and what's going on and, all the tea. Thank you guys so much for watching, and I will see you in the next video.